doesn't dawn upon you until they give you the rest pager and say you're on for all the rest calls in hospital during the day.
So being joined by Dr. May Wong, who's an Advanced Trainee in Gastroenterology at the Royal Prince Alfred Hospital, and also a Trainee Doctor Expert in Quality Improvement. May, at this time of the year, a lot of trainee doctors are stepping up to a new role. In particular, a lot are thinking about moving from being a resident medical officer to basic trainee in some sort of specialty area. And it's quite an exciting thought, but it's also a daunting thought. Do you remember the transition yourself? What do you remember of that change from being a resident to all of a sudden being a registrar?
I agree. It is a very daunting task, and it doesn't dawn upon you until they give you the rest pager and say you're on for all the rest calls in hospital during the day. But I think the ways to make the transition smoother really is to be yourself and to have confidence that the training that you've done for the last 2 years as a junior medical officer or longer has put you in good stead for being a registrar. I think it's important to be confident and be able to interact with nursing staff and your junior medical officers in a confident way that can provide people with reassurance that things are being addressed in a timely manner.
Yep. And you're projecting that confidence externally, but what do you do if you're feeling a bit nervous yourself? Who do you turn to? Where do you go?
So there's a lot of people to talk to in a hospital, and the friendly faces are obviously your colleagues, people that are also in the same shoes as you. There's also in the next department in haematology a person who's a registrar. Been a registrar for a few days. So just go speak to them, muse over your sorrows and your difficulties that you've had, and remember that there is another registrar doing the same thing as you. So don't be afraid, don't be shy, don't be scared to speak up if you are worried or if you have a problem.
Yep. Yeah. And what about handling the bosses? Because it's kind of, you're more directly in contact with them now. Some residents are, do work in jobs where they are in direct contact with the bosses, but often being the registrar, you're
the middle person. Yeah. Between the resident and the consultant. I think consultants are very human, as much as we think they're not. They're very approachable. So it's really about being sensible, and most of the time I found that consultants like to be called, like to be texted, and they at the end of the day want to know about a patient who's sick. So don't be afraid to call the boss. I've called lots of bosses at 2 a.m. in the morning, and I've never had anyone shout at me. So
I am a boss, and I would resonate with that we get more worried when we don't hear from trainees. And there's this inverse thing actually where the more senior the trainee gets, the more likely they are actually to call you, which is not common sense because they're probably more experienced and maybe they can value from your support, but probably they know what to do, whereas the junior ones often don't call as often. And that's to do with a psychological phenomenon that's well known called imposter syndrome. And it's all about your emotions rather than your logic. And so often when you transitioned into being a registrar, you kind of think, how did I get here? Did I cheat the system or something like that? It's the same feeling that everyone else is having at the same time, that all of a sudden that they're a bit of a fraud, but it's not the case. That's your emotions overriding, the logic of the situation. So be aware of that, I guess, and that it can be a bias. And if you are unsure about what to do with someone, it's probably a good sign that you should call the boss.
Yeah. That's right. If in doubt, always call.
Yeah, absolutely. And so there are a few months still before we change over in January, February. So there's a bit of time if you're a resident about to become a registrar to do a bit of prep. Anything that people could kind of do in the last few months before they transition over that could help?
Some last minute cramming. I think my advice, and I'm a bit biased, is that my last few months as a resident, I spent actually learning how a hospital worked. Yep. And that meant trying to dissect who I should speak to if I have a problem with ordering blood tests, or if I have a problem with things not happening quickly enough. And I think that's probably going to be most useful when you start as a registrar. Working out who's going to sort out your leave, working out how you're going to get conference leave, little nitty-gritty things like that. And then, I'm biased. I think thinking about how you can expand your horizons and not only be, say, a registrar, but also how you can get involved with things like teaching, education, and also starting a quality improvement project. And if you know that you're going to be in the same place as a registrar, you could start sort of the process, because it is a long process. If you're going to be in a different hospital, that's okay as well, because a lot of the problems that exist in one hospital percolate through another hospital.
Yeah. So start thinking a bit like a registrar, even though you are a resident, and the things that you'll need as a registrar and the things that you might be doing as a registrar, because you've got that sort of opportunity to start doing a few of those things early. I know particularly with physicians training, there's quite a heavy study burden. So my last question to you is going to be around balancing, firstly, learning a new role as a registrar versus the study requirements versus life, which probably should be the first thing that I mention. Any sort of advice for people that are transitioning into a specialty trainee role about life, learning the role of a registrar and meeting the training requirements?
It's challenging, and it's not easy, and it will take you time to settle in and work out how you're going to balance it, and it's not necessarily a clear divide. It's not 30-30-30. I think sometimes when you can coincide some of these activities, that is useful. So for example, studying with your work colleagues at work rather than necessarily having to take 2 hours at the end of every day is useful. In terms of balancing life, everyone has a different work-life balance mantra. And what I found really useful is keeping at least one day of the weekend to myself, which didn't involve any work. And it was hard, but it resets your mind and allows you to, I think, focus during the week when you do need to do tasks like study, but also when you do need to perform and make clinical decisions that matter. Trying to find ways that you can manage stress effectively is important, and to have downtime and to reduce burnout. We see it a lot amongst our colleagues. It's a very high pressured, stressful environment, and acknowledging that is important.
Absolutely, yeah. So maybe spend this remaining time thinking about particularly the life side and the things that you're going to maintain, and not let slip with the other things that are about to come along, because they are important. So May's tip is to keep a day for yourself, and I think that's a really good idea and would work for a number of people. Yeah. All right. Thank you very much, mate. I think that's been very informative, and look forward to catching up with you again sometime in the future.
Good luck to all the new registrars. You'll be great. Thanks, Anthony.
Thanks, mate.
Bye.
Cheers.